Hi everyone, our group is titled Bridging the Gap, Enhancing Medicaid Resource Accessibility at Comitis Crisis Center. We are Mark, Andy, Gloria, and Maura. Throughout this presentation, we'll discuss the community we partnered with, the intervention we developed, and how it has the potential to improve access to healthcare resources. Our community partner was Comitis Crisis Center, located in Aurora, Colorado. Comitis serves individuals and families experiencing homelessness or housing instability, many of whom face significant barriers to accessing healthcare. During our community assessment, we identified several key social determinants of health affecting this population, including poverty, unemployment, housing instability, environmental barriers, and lower educational attainment. We also found that Arapahoe County is racially and ethnically diverse, with Hispanic residents making up approximately 23% of the population. These factors helped us better understand the unique needs of the community and guided the development of an intervention that focused on improving access to healthcare resources.
Based on our assessment findings, our team developed a QR code-based Medicaid resource portal. The purpose of our project was to improve awareness of Medicaid benefits and increase healthcare access for adults experiencing homelessness or housing instability at Comitis Crisis Center by providing a simple, sustainable, and easy-to-use resource. The portal directs users to trusted Health First Colorado resources for enrollment, primary care, behavioral health, dental services, and transportation. Because our intervention focuses on increasing awareness and connecting individuals with healthcare resources before health problems worsen, this project represents primary prevention.
I'm Andy, and before developing our intervention, we gathered a variety of information from a variety of sources. So we reviewed the Colorado EnviroScreen as well as the Community Health Equity Map, which the particular data are on the screen. But as an overview, they showed us that the area experiences some of the highest environmental and social burdens in the state, which complemented what we found in our windshield survey that identified housing instabilities, safety concerns, and limited access to resources throughout the surrounding community of the crisis center to be paramount. We also went on to interview our clinical scholar, Alejandro Gort, who shared that the individuals staying at the center often prioritize immediate needs like food and shelter over healthcare, making access to preventative services especially challenging. So at the same time, there's also some community assets, particularly in the form of Anshu's Medical Campus being a world-class hospital and quite large. And then also there's access to the light rail system quite close by at the Fitzsimmons station.
So going into our project overview, so using these health literacy principles, our team then created a digital Medicaid resource portal that's easy to understand and simple to access just using a QR code. That portal directs the user to official Health First Colorado resources for things like enrollment, finding a primary care provider, getting dental, vision services, behavioral health, as well as transportation benefits that they can use. In addition to that digital portal, we developed an educational flyer that the staff can then use when giving to clients. We believe this project benefits both the overall community and Comitis. For clients, it helps reduce barriers by increasing awareness of available healthcare services. For Comitis, it provides a sustainable, low-maintenance resource that staff can continue to use after our project has ended.
This is the educational flyer we created to accompany the QR code portal. We designed it using health literacy principles by keeping the language simple, using clear headings, and organized the information into easy-to-read sections. Each QR code links directly to an official Medicaid resource, allowing clients to quickly find information in enrollment or specific covered services. Our goal was to create something that clients could easily use on their own or with the assistance of the Comitis staff. There is a QR code on the previous slide that links to this poster.
One of our greatest successes was creating a focused resource that addresses several priority Medicaid service areas while working closely with our community health nurse to ensure the information reflected the needs of the population. We also encountered several challenges. Medicaid information can be overwhelming. So one challenge was presenting complex information in a way that remains simple and easy to understand. We also recognize that technology access and language differences could limit the effectiveness of a QR code-based intervention. To address these barriers, we linked directly to trusted Health First Colorado resources, including multilingual resources whenever possible, and identified programs like Lifeline, which help eligible individuals obtain affordable phone service needed to access digital healthcare resources.
Although this project was completed over a short period of time, we anticipate several meaningful long-term impacts. By increasing awareness of Medicaid benefits and connecting clients with preventative healthcare resources, this intervention has the potential to improve continuity of care, support chronic disease management, and reduce barriers to accessing healthcare. On a broader level, we hope this project promotes health equity by increasing access to community healthcare resources while providing Comitis with a sustainable tool that can continue benefiting future clients.
When it comes to evaluating the effectiveness of this intervention, we recommend assessments at 3, 6, and 12 months. At 3 months, Comitis could review QR code engagement and gather initial feedback from staff as well as those using it. At 6 months, they could compare engagement trends and determine which healthcare resources clients access most frequently. And at 12 months, staff could evaluate overall use of it and ensure that all the links are still current and update resources as they need to be changed. Together, these measures would determine whether the portal remains useful, if it's sustainable, and the overall responsiveness to the needs of the community.
In conclusion, our project was designed to improve awareness of Medicaid benefits and increase healthcare access for individuals experiencing homelessness or housing instability through a simple and sustainable Medicaid resource portal. We'd like to thank Comitis Crisis Center and our community partners and the faculty for supporting this project throughout the semester. We hope this resource continues to serve as a bridge between the immediate support provided by Comitis and the healthcare services available throughout the community.
Throughout this project, we use current evidence from peer-reviewed literature, Colorado public health data, and trusted government resources to guide our interventions. We also incorporated feedback from our clinical scholar and community partner to ensure our project met the needs of the population that we served. Our complete APA reference list is provided here. Thank you, appreciate you for your time, and we'd be happy to answer any questions in the discussion board.